Hey, this is Konrad from Switzerland, and I'm fortunate to be able to talk to a lot of extraordinary people, but it's rare that I get to talk to someone who is truly and literally one of a kind. Timothy Ray Brown has made his way into medical history as the Berlin Patient, and he was the first person on this planet to be completely cured from HIV. This makes him one of the most famous patients in medical history, and we'll talk about the very interesting story and how this was possible, as this actually happened when he was treated for leukemia, which he has also survived not once but twice. And he's now an activist and wants to raise awareness for HIV and AIDS, and I'm really glad he found the time to talk to me. Thank you so much, Timothy Ray Brown. So you are one tough cookie.
Well, first of all, I want to say thank you very much for having me on this, and it means a lot to me, and I think it's great what you're doing. And I guess I'm tough. I don't know. I just decided I wanted to survive and did.
Yeah, well, not once, not twice, but maybe three times technically, I guess.
Right. Yeah. True.
Yeah. Wow.
True,
Wow.
yeah. The HIV, and when I was diagnosed, it was still a death sentence. It was 1995, and there wasn't any really good treatment out there yet. There was only AZT, and that was actually killing people. And so I told the doctor that tested me, told me my results, that I didn't want to take AZT. She was trying to pressure me to start medication, and she said she'd give me a very small dose of it, and she did, and I did okay on that. And but luckily, new medication came out onto the market the next year, 1996, and I was able to take first a dual combination, and then they started recommending triple combinations, and so they would combine drugs and try to come up with the best treatment for people. And so I got that, and as soon as when testing viral loads, viral load is the amount of HEV in 1 milliliter of blood. When they could do that, I finally, I think it started out with my viral load being above the level of detectable, and then it got down to undetectable.
Oh, okay.
And so at the time I found out I had leukemia, it was 2006, and I was actually undetectable for HIV. So that meant that they could treat me basically like a normal, like any other patient with leukemia. And so I started out with chemo treatment, and that would get my the leukemia into remission, and then it would then I was supposed to get 4 rounds of chemo, and unfortunately during the 3rd round of chemo, I developed a sepsis infection.
Oh, okay.
And so it was really awful, and I had to. We're doing an interview. If you close the door, please. You're distracting. It's my partner. He's distracting me.
No worries.
Okay. So anyway, I had to be put into an induced coma because I was breathing very heavily, and my blood pressure was very low, and I had a tendency to read everything that happened to me on the internet, and I found out that 25% of people who are put into induced comas with sepsis infections don't make it.
Wow, well, that's a pretty high number. Okay.
Right. So I lucked out there, and then after the second transplant, Dr. Gerhuter said that he wanted to test my blood to see if I had any possible donors for a stem cell transplant, a bone marrow stem cell transplant. and I didn't really understand why, because in my head, I was going to do 4 rounds of chemo and then it'd be over, and that'd be it, and I'd be cured of that. And he said, well, just in case that doesn't work. And so I said, okay. So he sent my blood to the donor bank, the German stem cell donor bank. And I would ask him every day how many donors there were. And it went from like 0 to, it went up and up and up. And then finally it came out to 267 possible matches.
So that's a pretty high number. Usually you don't find that many numbers. So you were lucky to
yeah, very, very lucky. Yeah.
Have a good, is it like a blood type that you have a lot of?
Well, it's blood tissue type.
Tissue type, okay.
It's different than blood type. Yeah. In fact, some people don't have any donors at all. I was in the hospital at the same time as a Romanian friend of mine who actually didn't find any donors for him. So he had to get a stem cell transplant from his mother because he can do it from his siblings because either he didn't have any or I don't know. Anyway, he did it from his mother and he didn't make it, unfortunately.
Oh, that's okay.
Yeah. And that was kind of a drag. It was kind of a drag on my psyche. Yeah, I was kind of like,
imagine this.
Yeah, that's not good. So anyway, I had 267 possible donors, and Garo Hutter came back with the idea of trying to find a donor who was immune to HIV. It's 1% of Northern Europeans have an immunity to HIV, and it's called CCR5 delta 32, which means that they don't have the doorway for the HIV to get into the T cell.
Okay. And so the virus cannot dock onto the cells.
Exactly. Yeah. Okay. Yeah. And so he thought maybe he could find one of those donors, or one of the people that was my donors might be have that deletion. So he looked and he got permission from the professor. It was a university hospital, so he had to get permission from the professor to look for such a thing. And he got the permission, and so he looked and looked and looked, and then I guess he started out with the German population of the possible donors, and he found one on the 61st try. And so then they petitioned this person to do it, and the person said yes, he'd do it. And I know it's a man because I found out that it's a man who was actually German from the Cologne area, that he was studying in New York City.
Okay. So did you ever get to meet him, or?
No, unfortunately not. In Germany, with the German blood or donor bank system, you have to, both parties have to petition to see the other person. And I didn't petition for a long time, but then I finally did, and just last year. So I haven't heard an answer yet. So hopefully I will. So I have no idea what the donor knows about my case at all. I don't know if he knows that he kind of revolutionized history in HIV care.
Yeah, that's the truth.
Or HIV, look for an HIV cure. I have no idea what he knows. I decided to look because a friend of mine from Hawaii, who's a professor, he is a professor at the University of Hawaii, said that he would like to get me and my donor and Dr. Hutter together and invite them to Hawaii. So
that would be nice.
Yeah. And
so at that point in time, did you need a transplant, or was it something that was they wanted to try?
After the second transplant, I found out that my leukemia was in remission, and so I actually said no to the transplant at first. I said I'd do it if the leukemia came back. So I lived life and as well as it could. I was actually in pretty good condition after having that sepsis infection, and then about the end of the year, the leukemia came back at the end of 2006, and then I said, yes, I'll do it, and so they arranged for the donor to fly back to Cologne and get the stem cells. And with a stem cell transplant, it's not. They used to have to actually open up the bones and pull out stem cells from the bones. But now they basically give a medication to the donor, which is a medication which kicks the stem cells out into the blood, and they just filter it out.
Okay, so you don't need to. I think they did it in the hip, right? In the past, they used to extract it from the hip.
Right.
You don't need to do it anymore. Okay.
No. It's very easy now. It's just basically like getting
blood transfusion or something.
Yeah, something like that. Yeah. And then so the transplant was set up for February 7th of 2007. And before the transplant, my partner at the time, he thought that he was smarter than the doctors, and he said he thought that my taking the medication would reduce the chance of the stem cells to reproduce and do what they were supposed to do. And
so the HIV medication.
Yeah, exactly. Yeah. And so I talked to Gary Hutter about that, and he said, well, he'd already brought in a protocol saying that I was supposed to take my medication and continue taking it. And I told him what my partner thought, Michelle, and he said, oh, well, I'll get back to you. And so he came back on the day of the transplant and said, okay, I've changed my mind. Here's the new protocol. And so it basically said that I would quit. I would take my medication on the day of the transplant and not take it anymore. And that's actually kind of important, because if I had kept taking my medication, they wouldn't know for a long time after that if I were cured or not.
Cured from HIV in that case.
Right, cured from HIV. Yeah.
Okay. So the medication pushed your levels below the thresholds of where you can measure it.
Detection. Yeah, detection.
The level of detection. Okay, threshold.
Right.
Okay.
And so I quit taking my HIV medication on the day of my transplant and never took any after that.
Okay.
And
then at what point did they find out that the HIV was gone? I mean, I guess.
I realized that I went to a rehab center and then finished that, and then decided to go back to work, and then go back to the gym. And with HIV, I had not been able to gain muscle weight, or actually had any definable muscles, but without HIV, I was starting to gain muscle weight, and I was starting to show muscles.
So you were feeling better. You had sort of better health in general. Okay.
Definitely, yeah. And then clinically, because I wasn't taking medication anymore, my viral load went really, really high. I'm not sure exactly how high, but then it slowly dropped down to by May of 2007, it was undetectable.
Okay, so it wasn't right after the transplant that they were going down. So the first they went up, and then they started to go down.
Yeah, right, because there was nothing to prevent it from reproducing.
Okay,
at first.
So it takes a while for the stem cells to basically take action in your body and become active.
Yeah, exactly. Yeah. So anyway, by May 2007, I didn't have any HIV in my blood anymore. But unfortunately, there can be blood, or there could be HIV in reservoirs, like in the gut or the brain or lymph nodes. And so it's kind of unethical to check people's brains to see if they have HIV in their brain.
So how do you do that? Drill a hole?
Well, after the second transplant, I had to get a second transplant because the leukemia came back. And the leukemia came back at the end of 2007. And then I got another transplant in 2008, like about a year after the first one. Like,
was it from the same donor?
Yeah, from the same donor. Yeah. And that one didn't go as well as the first one. For a while, I became delirious. My brain wasn't functioning correctly. And so they thought I might have leukemia in my brain. So they decided to do a brain biopsy and, of course, check for HIV too.
I see. Okay.
Of course, that was probably the main reason they wanted to do the biopsy. But unfortunately, the surgeons left an air bubble in my brain, and I became more delirious.
Oh, okay. So it went downhill from there.
Yeah. But then they did an emergency surgery and removed the bubble. But just having the bubble there for that short time affected my balance. Even to this day, my balance isn't great.
Okay.
I do a lot of work on that, physical therapy and yoga, but it's still not perfect.
There's some sort of neurological damage from that bubble.
Right,
that was left.
Yeah, exactly.
Okay.
Exactly. The initial damage basically left me bedridden. So I was in bed, couldn't move, incontinent, and so at some point, Dr. Huger told my partner Michelle and his sister, who was a nurse, that there was nothing else they could do for me. So they sent me home and gave me morphine patches.
Okay.
And they've basically given up on me.
So just treat the suffering, but there's nothing else we can do.
Right. Exactly. My former boyfriend at that point, because we had broken up because I had a crush on a straight boy at the gym. He didn't want to believe it, and so he started looking for other places to send me away from that hospital, the original hospital. And so he found a clinic with the help of an oncologist who actually diagnosed me at first. He found a clinic for people with extreme brain injuries. And so I was taken by ambulance to that, and when I got there, I was in bed, I couldn't move, I was incontinent, and the nurses were too busy with all the other patients that they had no time to clean me up, and so my partner would have to come in, or my ex-partner would have to come in and clean me up.
Okay. So, were you conscious, or were you in a state of like delirium?
Yeah, I was conscious. But I was pretty in bad condition. I didn't even realize this was all going on. I didn't know about it until later. Basically, Michelle allowed the doctors in the hospital to take all the glory for coming up with this cure for HIV and all that. But he wanted to point out that there was more to the story, that they had basically given up on me. And so anyway, I was given a physical therapist at this clinic, and that clinic got me out of my wheelchair out of bed into a wheelchair, and then from the wheelchair after several days to a walker, and then eventually to walking.
Wow. Okay.
So I learned to walk again.
So then that took a few years of therapy.
Well, a few weeks.
Few weeks. Okay.
Yeah, a few weeks. Yeah. Yeah. It seemed like several days, but I think it was several weeks.
Okay.
Yeah. So a good friend of mine from Seattle, where I grew up, decided she was going to come and visit me to basically say her goodbyes to me. And I knew she was coming, and then she showed up, and so when she showed up, she saw I was walking, and it was
so she was,
wow,
that was quite a surprise.
Yeah, big surprise. Yeah. So my mother came and visited me 7 times during this period that I was in the hospital, and in fact afterwards I won a trip to Turkey to the Turkish Riviera, and she's like, "No, I'm sick of Europe. I'm sick of Europe. I don't want to go." And actually, it was actually good because the whole tour was in German, and so I invited a friend who speaks German, from Seattle actually, to go, and so yeah, we had a good time.